thank you so much for joining us tonight. We are going to be covering bleeding and burns. Now, some of you have got children at home. Well, most of you, I imagine, have got children at home, if you do have children. And of course, they are not going to be going to school. They're not going to be asking the school reception or school nurse for any help. You're going to be the one that's going to be dealing with all these major and sometimes minor bleeding that might happen in the workplace. So I just want to equip you with some confidence and knowledge, so going forward you will know how to be able to treat these things. So let's start off with, first of all, bleeding. We've got lots of different types of bleeding. You know, we can have minor bleeding, major bleeding, and it all comes from different blood vessels. So we've got 3 different blood vessels in our body. So imagine I've got a cut here. We could be bleeding from our arteries, our veins, or our capillaries. Now, if you bleed from an artery, you know you're bleeding from an artery because blood is squirting out, or spurting out, or pumping out, whatever word you want to use. It's coming out quite quickly. Whereas if you lose blood from your veins, it kind of flows out a bit like a tap would. And if you cut a capillary, it will just kind of seep out or ooze out slightly. Now, the average adult would have around about 6 litres of blood inside them. You only need to lose 1/5 of that before you can start suffering from shock. And shock's really serious because if you're suffering from shock and you don't treat it, you're eventually going to cardiac arrest. So our job is to make sure we keep the blood inside that person. So I'm going to just demonstrate with a bleed that's on my leg at the moment. So this is just a bleed maybe from our veins. Hopefully you can all see that there. So blood is just flowing out. Now, really want to make sure that we've got clean hands. And I know we all know how to be washing our hands at the moment, making sure our hands are very, very clean. And if you can, it'd be really good to make sure you've got a first aid kit in your home. So first aid kits don't necessarily need to look like the workplace one that you might see here. You know, you might have a first aid kit similar to like a pencil case that you might carry around with lots of bits and pieces inside. But I definitely make sure I have some plasters in the house. Make sure that I've got some dressings as well, and dressings come in different sizes. Plasters will come in different sizes, just for different cuts that we might come across. Now this is quite a big bleed, so a plaster's not going to be able to do anything to it. We must make sure that we get actually our dressing out. So it's bleeding out here. I'm going to make sure I put my gloves on, and if it was somebody else here, I'm going to be asking them to put pressure on there to stop the blood from coming out. But as I've only got my hands at the moment, I'm going to struggle to do pressure on it myself. So gloves on, and I'll make sure then we put pressure on the wound. We don't want to be touching somebody else's blood. Clearly, if it was mine, it'd be okay. I can do that with my own hand. But I do want to make sure they're clean first, because we don't want to get any infections in there. Then I'm going to get my dressing out of the first aid kit. Now the dressing, if you unroll it, it has a nice shiny side, I don't know if you can see that, and it also has a bandage side. And we don't want the bandage side to stick on the wounds. There's a shiny side we're going to put straight onto the wound like so, and then we're going to seal it all the way around, making sure you cover that dressing as best you can, just to stop any infection from getting in there, because you want to make sure it's nice and clean. And then we tie a nice pretty bow on top. If you're no good at bows, safety pin it, tie a knot, whatever you wish, like so. Okay, so it should be nice and sealed. Hopefully you can all see that. We don't need to elevate these limbs anymore. We can just keep them like that. If blood starts coming through that one though, we're going to go and get another dressing and put back on. Now, if we don't have any dressings in the house, you can use anything at all. Now, I've got some ideas here. We've got maybe a scarf that you might want to use to be able to cover the wound with. Or maybe you can use a tea towel. This is a special tea towel. This is my grand's tea towel actually. That you might be able to just put over the wound like so. Or if you've got children, you might have, I don't know, some tights at home, and they're quite good. Just put them over the wound and secure it into place like so. Okay. You do need to make sure that ideally as possible you try and keep that wound clean, and you try and do it as sterile as possible. But if you don't have anything clean, you've got to use something to stop the blood. Okay. Now obviously you need to go and seek help if you can't control it, but most bleeding should stop with pressure in about 10 minutes, and then you might need to go to hospital depending on the type of cut it is. You know, if it's open quite a bit, you want to make sure you go and get checked out, and also if it's got something embedded in there, you also want to get checked out. And anyone that's got a bite, you know, a human bite, so another child bites another child, and it pierces the skin, or an animal, dog, foxes, things like that, that place of skin, you must make sure you go and seek some medical advice about that. Let's do an arm wound as well then. So here's my little guinea pig, my Anne. Got an arm wound, she's got a small cut on the arm. We'll do exactly the same thing. Get our dressing out and we make sure, in fact it's quite a small cut, so I'm going to just make my dressing a bit smaller here. Just fold it back on itself, like so. And then put that on there. And then we do exactly the same as we did earlier. We're going to just make sure we cover, oh, there we go, cover the whole dressing all the way over. And it's quite hard if Anne doesn't have another arm or hand to help me hold it. But we'll just keep on going all the way around until we can tie a nice pretty bow, which hopefully will be now into place like so. Okay, and again you've covered the whole dressing there and you made sure you've sealed the wound. And we no longer need to elevate these wounds. And the reason why is because if they've broken it, you can make that worse. So just get them to relax. However, if Anne or me starts feeling a little bit woozy, then you must make sure you treat them for shock. Because remember we said, if they lose too much blood, then they will suffer from shock. And sometimes you don't know how much blood they've lost because it might be internal bleeding. So you might not be aware, you know, internal bleeding is like a bruise. So you must make sure you lay them down and you put their legs up in the air. So I'll just demonstrate with Anne here. So we just lay Anne down. Clearly she hasn't got any legs, so I won't be able to lift her legs up. But I'll be lifting her legs up and then I'll be keeping her nice and warm and I'll be able to put a blanket over them, like so. And lifting her legs up, maybe rest them on a chair. There's a saying, if the face goes pale, raise their tail. If the face goes red, lift the head. Okay, so maybe sit them up. So let's cover then head injuries. I'm just going to look at some questions. If anyone's written any questions down over here. No one's written any questions down. So it makes it even easier for me. Hopefully you're all keeping up though. So hopefully remember you've got to try and make sure you put your gloves on. I'm just going to take this one off just now. Make sure you put your gloves on, make sure you wash your hands, make sure everything's clean before you start touching other people's wounds. Also, if you're touching your own wound as well, you do want to make sure you're clean before you're doing that. But there's a special make sure that you definitely stop cross-contamination when you're touching somebody else. Right, now this person here, oh dear, they've got a head injury. Now, with a head injury, you don't want to lay them down because you don't want too much blood flowing to the head over there. Okay, so you want to make sure they are sitting up. So Lulu is sitting up here in this case. Make sure it comes over here, just so we can all see. And I'll go get my Stella dressing again. I might make it a bit smaller because it's kind of a small wound there. And I'm going to hold it across there. Then I'm going to seal all the way around and go down the back of the head. Otherwise it'll just fly off the head, especially if you've got hair like mine. Or the hair will start looking like mine. Go all the way around. So it's sealing off the dressing as we go. Around the back. Oh, sorry. It's quite difficult with two hands like this. Normally I ask my cashier to hold, but Anne, Annie, what are you doing? Don't get over your eyes. Keep it on that wound there, please. Thank you. All the way around. Keeping it underneath the head, like so. Thank you. And tie it, or safety pin it, whichever is the easiest thing that you can do, depending on the size of the dressing. Now, if you're having problems like I am at the moment, and it going all the way around, you don't need to tie it there. You can tie it at the back of the head. Doesn't matter where you tie it. Just try and make sure you cover the dressing like I have. Now again, if you're still having problems, what I do quite like doing is making them into a pirate. I mean, that is okay, but just in case it wasn't tight enough, you could get your triangular bandage out and make some kind of funky bandana, especially if it's on the top of the head. So if it was on top of the head, I might get my cashier to hold some kind of dressing in place, maybe like this, you know, a small little cut, get a clean sterile dressing and just hold that in place. And then I'll put my bandana over the top, making sure I don't cover the eyes. And then I'll tie it at the back so she looks a bit like a pirate. There we go. And I can adjust how tight I do it. I should probably demonstrate this on myself rather than a slippy head. And you can do it, tie it up here as well if you wish. Like so. So that should actually put pressure on the wound at the top of the head. I think it's quite flattering, she looks a bit like a pie, but there we go, just stay there. Okay, now that's for kind of a bleed from our veins. And we said we're going to put 2 bandages on. After that, we're going to take them both off and we're going to start again. Now, hopefully you're never going to come across this, but if it was a major bleed, you know, maybe an arterial bleed, maybe someone has had a road traffic accident, or maybe a stabbing when a knife's gone in and pulled out again, there's a big hole in the leg, then we can go to the next step. And the next step is what we call hemostatic dressings. And you probably don't have one in your first aid kit, but they come in a big wad like that. When you unroll it, it's a big wad of dressing. I mean, you could use a nappy or a sanitary towel, or just lots of dressings, or even a t-shirt you could just take off your own back. And you kind of just got to pack it into the wound. So imagine I've got a cut here. I get the dressing like so, and I pack it in, and then I unroll it. And this one's got a small plastic cup here, which actually makes it push down deeper into the wound. There's lots of different types of these you might get, depending on where you get them from. Just go all the way around like so. And hopefully that will stop the bleeding. Okay, so we've gone different steps. So the first step was to make sure that we put direct pressure on the wound, making sure I'm sitting down. We put another bandage over the top of that. If that still hasn't worked and blood is pumping out like an arterial bleed, then, like I've just shown in the leg, then we need to use our hemostatic dressing or packing. Just shove inside the wound and make sure you secure that in place. Now hopefully blood will stop. But if it wasn't, you would go to the final step. And this is only on rare circumstances where it's just not stopping. And that's when you would apply something like this. Now this here is called a tourniquet. Now you're not going to have this in your home first aid kit, but let's just imagine, I don't know, outside, hopefully it'll never happen, but maybe there's a stabbing or a traffic accident where there's someone is bleeding lots of blood, and it's not going to take long before they lose 1/5 of their body or blood in their body. It's going to take a few minutes, if that, so we must act quickly. And we've done all these stages and that's still not worked, so now we're going to apply the tourniquet about 5 centimetres above the wound. So secure it into place, and it's got a bolt in it like so. And this bolt here, all I need to do is just twist it until the blood stops coming, and I will secure that into place. And you must record the time you put this on. But I suggest you probably don't write it here, you probably write it across their forehead because this might be covered in blood. You never ever take this off, this stays on, okay? If you take it off, then it could cause a person to go into cardiac arrest, because all this bit of the body here, there's no oxygen going to it, and all the toxins can build up, and as soon as I release that, all the toxins will then go into the rest of my body. So doctors, paramedics, they will know how long they have before before you lose a limb. There was a saying, life over limb. My life is more important than the loss of this limb. So I hopefully remembered a few sayings. If the face is pale, raise their tail. If the face is red, lift their head. And life over limb. My life is more important than the loss of this limb. Now if you haven't got a tourniquet, which most of us probably don't have that in our first aid kit, then you could use a belt, but you don't want to use anything thinner than this, because if it's thinner than this, which is roughly about 4 centimetres, maybe 5, if it's thinner than this, it will do a 7th their limb off, and clearly you don't want that to happen either. So it must be quite substantial and quite thick. And try and get something that can help with the twisting. It's not how tight you can pull it, it is the twisting action that will make it more secure for you and will stop that blood from coming out. I'm going to take this off because it's a little bit too tight at the moment. And put that over there. Okay, so that's bleeding. Has anyone got any question about bleeding? I just want to move on a little bit onto maybe embedded objects. So let's say then, that's a knife before anyone suggests any rude comments on there. That's a knife that's embedded into my leg, or maybe I've got a nail that's stuck into my finger. If this happened, please don't take it out. Please don't push it down any further. You just got to make sure you support either side of the wound and make sure you seek medical help quickly. I mean, in this case, you can walk into an A&E. If someone's got a knife in their leg, you've got to be calling the ambulance, because you can't ask them to stand up, because as soon as they stand up, you're going to make that worse. So in bed objects, leave well alone. You can put pressure either side of the wound to stop it from moving around and also to control any bleeding that might be occurring at the sides. I've done head injuries as well. If someone has hit the head like this, Annie has, make sure they do seek medical help with that as well, because head injuries can also be quite serious. They might have concussion or compression. My finger's just fallen off. Probably unlikely that's ever going to happen. You're more likely to use a tip of a finger, maybe in your doors or car door, or maybe if you're gardening on the lawnmower or something like that, you might just take off the tip of the finger. Please look for the tip of the finger and make sure you treat the person first. So treat me, if it's my finger that's come off, make sure I'm okay, make sure you treat me for shock. Remember that maybe lifting my legs up and keeping me nice and warm, and then go looking for the bit of finger. And then you need to put the finger in a bag, remember I prepared earlier, and then you can put that into ice. You do not put the finger directly into ice, because if you do, then unfortunately it's going to destroy the tissues and it's not going to be able to be stuck back onto me again. And when I say stuck, not what you're going to do, it's what the hospital's going to do for you. Okay, I've got Leanna asking about nosebleeds. So if I did have a nosebleed, first of all, you got to kind of find out what happened. You know, have you fallen over? Maybe Anne's got a nosebleed because she's fallen over and hit her face. And if that does happen, you do need to seek medical advice. But people do get nosebleeds for lots of different reasons, whether it's the weather or whether they've been picking their nose, especially children, hopefully not adults. So you must make sure that you pinch the nose. Do not put your head back like most of the adults I know do. I think it's only to protect your carpet you do that. But pinch this bit of the nose, the soft tissue of the nose. You can't pinch this bit, this is bone. The soft tissue of the nose here, and you might get a cloth or something, or a bit of tissue, and hold it underneath. So it's soft tissue of the nose, and hold something underneath just to catch any blood flow. And make sure to breathe through the mouth when you're doing that. It's constant pressure here, leaning forwards, do not go back. And maybe an ice pack on the bridge of the nose can also help as well. But it will stop. Remember, if it hasn't stopped after 30 minutes, you must seek medical help. Okay, anyone else asking questions on here about bleeding? No, just looked at myself there, looked quite funny. No, okay, so the last thing I want to cover then will be burns. Now, hopefully it will never happen, but we can get burnt in our home quite easily. You know, the hair straighteners, the iron, the oven, we can get friction burn from the carpet. I don't want to know what you've been doing to cause that, but you can get it on your knees. You can, I don't know why I'm laughing, sorry. You can also get it outside, maybe on a slide, you can get sunburn. There's lots of different ways we can get burnt. If you have a burn, you must run it under the cool tap, not cold, cool tap for at least 10 minutes, okay, at least 10 minutes. Now if I burn, let's say I burnt this bit of the body here, please don't put the tap straight on top of there. Make sure the tap flows over the top of it here. So it doesn't, otherwise it's going to be really painful if you put the tap straight onto the actual wound itself. So 10 minutes under cool water. And if you've taken a layer of skin off, you're going to need to cover that, otherwise it's going to get infected. So make sure that you get some cling film handy, or if you haven't got any cling film, you maybe get a plastic bag or maybe one of your gloves and just cover it to make sure, and loosely cover it after you've cooled the wound down. And then you must make sure you seek medical advice if it's on a child, if it's on your hands, face, feet or genitals, if it's bigger than the palm of your hand, and if it's a deep burn, or if it goes all the way around a body part. But if you manage to cool that burn down first, it's so important to do that. Please cool that burn down for 10 minutes. We do have these burns dressing kits in the first aid kits, but the current guidelines are saying these are probably not a good idea, because if you put one of these on, what it will do is keep the heat inside the body, which is not what we want. We want the heat to be able to come out so we can cool it and then we cover it with some cling film. Okay? Now, if anyone burnt themselves with some chemicals, maybe you got really excited this week and decided to do lots of cleaning, and we'll probably have really clean houses, won't we? If we're in lockdown for a while. But if anyone's been cleaning with chemicals, whether it's the garden chemicals, whether it's your chemicals on the kitchen sink, and you spill them on yourself, you've got to wash it and run it under cool water for at least 10 minutes. No, sorry, 20 minutes. You've got to wash the chemical away for 10 minutes first, and then you cool the burn down for another 10 minutes. So it's at least 20 minutes for a chemical burn. Please do not put any lotions, any potions, or any sprays, or anything else that you might have been told by grandparents, mothers, anyone else. Please don't put anything on there except for cool water. Do not listen to all those old wives' tales. They do not work. They make it worse. You've got to cool that burn down. Otherwise, you're going to be left with a really bad scar. Okay? Any other questions there? No, okay, I'm going to call it a night for now. I'm going to do another one of these. Someone's asked me to be able to cover recovery positions and also to talk a little bit more about what to do in an emergency and how to prepare for that. So I'll be doing another one very shortly. I'll advertise that on my Facebook page. Thank you for listening, guys. Please keep safe, please keep well, and stay home. See you soon. Bye-bye.